breaking barriers and bridging the gaps between patients and doctors. Welcome to Brainstorming with the Docs and your co-hosts, Dr. Glenn Harrison and Dr. Kolby Condos.
All right, everyone. Welcome back to this week's episode of Brainstorming with the Docs. I'm Dr. Kolby Condos, my co-host and good friend, Dr. Glenn Harrison. How's it going, buddy?
Doing great. I'm looking forward to this one.
I am too. I am too.
I always say that with our podcast, but I think this one is, well, naturally it hits home for both of us. And it's kind of the theme, a little bit of the theme of our podcast.
Yeah. This one is going to be good because I think that it's going to provide some insight into what things actually look like and what some challenges are associated with what we do, and also why we choose to do what we do.
That's right.
In part. So today we're talking about what are the pros and cons of being a functional medicine practitioner. If this is your first time watching or listening, please hit like and subscribe and turn on notifications because we're going to continue to roll out content each and every week, and you never know when we might do something that's applicable to you. So what are the pros and cons? First off, let's talk about what is functional medicine, right?
I just had this question today. There was a colleague of mine. Actually, he was a friend. He came to my office and he said, because he didn't know really about this functional medicine model. And he said, well, could you just, and he had his keyboard out and everything. And I was like, what is functional medicine? I'm like,
here's what you should do. You should go listen to our podcast.
Go listen to the podcast. So yeah, if you're watching this, listening to this, you probably already know. So functional medicine's roots come in. The goal is to understand the underlying causes of any kind of health disorder. That's the goal. That's what it's being. That's kind of how it came about. But functional medicine isn't a different kind of medicine. I always like to say that it's kind of where the old meets the new. The old meaning maybe more lifestyle before massive pharmaceuticals came in, and the new with the most advanced diagnostic laboratory testing on planet Earth. I could confidently say that. I know you could do too as well, Dr. Kolby, because most 99% of functional medicine insurance doesn't cover, and insurance creates the limitations and rules of diagnostic testing. We have a podcast on insurance. And when you don't have to follow those constrictions, it doesn't matter what you need. And
it opens a lot of doors for you.
Yeah.
Right?
So in a nutshell, that's functional medicine.
There you go.
Okay.
So what are the pros of doing functional medicine? I think that this is a question like, why did we choose to implement this into our practice? Why did we choose to do this stuff? I think for me personally is because it's super interesting. I always use the analogy. It's like a puzzle, and you're always looking for what piece fits where. If this isn't working, what is that going to manifest itself? So you're always investigating. You're always looking, really in depth at things, and it's super challenging in a lot of cases. And for me, that's exciting. And when you help someone, I think that it's that gratification where when you have someone that's had a chronic issue, or they've had an issue that, no one's really investigated or whatever, and you help it is very, very, very addictive. It's addictive and it's super gratifying.
I completely agree. I think when you ask any provider, especially in the world of healthcare, it doesn't matter what you are, and you ask them why they're doing what they're doing, they're always going to give you their personal story, at least to some extent. Most people have some story. Same with me. I got really sick and in school. Maybe my health wasn't great before school, and I met this doctor, practiced functional medicine. I didn't know what it was. I thought it was kind of crazy. It was like, and we were doing more chiropractic. And then I was able to see things that I couldn't imagine. And really this doctor helped me out and gave me the guidance, and I was able to turn my own health around. So I have that personal component to it. But once I got into it, I was like, wow, I can't see I can't see healthcare being any different with my situation. Of course, I'm biased because it helped me. But then I started to practice, and it was almost limitless when you really dial into, lifestyle medicine, understanding pharmacology to some extent, and nutraceuticals, and biochemistry and pathophysiology. So understanding the true roots of how the body works and looking for the dysfunction. And like you're saying, Dr. Kolby, when you're working with somebody and there's literally 30 years of disorder, 40 years of disorder, they're on the brink of, I'm giving up on life. And when those people walk in and they don't have any hope anymore. So that's we'll get to that challenge in functional medicine. But when they do get a glimmer of hope, they get motivated. And if you are able to, like we are, have front row seats to it, to be able to witness this and be part of it, there's nothing better in the world than that.
No, super empowering. It's super addictive, and it's amazing. It is super cool. It's one of the coolest things you'll ever experience when you see someone take their health in their own hands, and you're just the guide, right? We always use the analogy: you're the architect and they're the contractors, right?
Yeah.
You tell them how they're going to do it, and then they go out and do it, and it works, and they feel better, and their quality of life improves, and you see them interacting with their family, and they come in, they're vibrant again.
And you
rewarding.
Yeah, and you strategize with them. They're your partner, they're your teammate to work through it. They execute it. You direct and guide and educate, and then they give you feedback, and then you strategize together. I think that's an important thing. And when you do it as a team, it's not just a win for the patient when they turn from a severe type 2 diabetic to normal blood sugar, which the medical community would say that's impossible, or either serious autoimmune disorder that someone's practically in a wheelchair and now they're running marathons. This happens. And then when you can be part of that, it's a game changer. And it's not only a win for the patient, it's a win for the provider, because there's so much skin put into it. So I don't know. I know we could harp on this a lot, but there's a reason why we're harping on it, because there's a lot of investment.
Passionate about it, right? That's the biggest thing.
And there's a lot of investment in it, so you wouldn't do it.
There's a lot
for
of
the provider. As a provider, you wouldn't do it unless there was massive returns on your emotional and physical investment. Yeah.
Well, I think that you just brought up a good point. Even when you said like the time component, like that's one challenge, not just for the provider, but also for the patient. Like it is not the silver bullet. It is not the get better quick program. It is going to be a lot of work. It's a lot of time investment. It's a lot of effort investment. We always use the example, like my new patient exam is an hour long. And then usually the follow-up is also an hour after that. It depends on the patient, but for the most part, it's an hour new patient exam and then an hour review of findings. And then there's always laboratory analysis and imaging and all that other stuff that we need. Versus it's not easy or convenient for the patient to come in for 2 1 hour appointments versus when they're used to going in and getting between 15 and 30 minutes with their provider. So that is something that's difficult.
Yeah. The American average right now is between 7 and 8 minutes for an appointment. Some are less, some are more. So you're right. There's definitely an investment of time, money, resources, patience, and effort.
Yeah, it's not fast for both
parties. For both parties, yeah. So you really need the right teammate. You need the right doctor going into it, and the doctor needs the right patient. Or I don't even really call my clients patients, because there's an interesting psychology to patient. Patient means doctor will fix you. I say client, we're going to work together. It's subtle, but it is powerful. So
right, and even if you lay out the most like to the point, well-structured, beautiful plan in the world, if they're not able to implement it and follow through, then it's not going to work.
Useless. Or that very structured direction is not theirs, and then they slip and fall because it's not working for them. So then you got to backtrack, figure it out, and guide them along the way. So anyway, a lot of things to be benefit that are very positive from the provider standpoint. There's some challenges. Again, the time consuming. When you get that involved with your client, I'm going to call my clients. When you get that involved, and you myself, when I'm working with them, I got to know everything about them. I got to know what's happening in their home life. I got to know what's disrupting their sleep. It might not be something you could find on a lab. What's disrupting other parts of their life? What's happening for their stress management? Is there stress? How's their workload? Is there something new that came up in their life, in emotional hardship? It's just so much. Where are they living? Are they living close to a factory? Do they have a history of mold exposure? There's just so much, and you can't know that much about someone you're working with without there being emotionally messy, just like any relationship, right? Any collaboration, partnership. So it does get emotionally messy. That's a challenge. It gets emotionally messy for the patient too, because they're the client, because it's not a direct, they're going to slip and fall. It's not a linear path from start to finish. There's going to be all sorts of stumbles. And you need a provider that's going to help you navigate through those stumbles, because it's a stumble for both parties. As I mentioned, there's a relationship component to it. And then there's a belief system that has to change, especially if we're already molded with the clients or patients, from the doctor standpoint. If the patient is already molded into a certain model, it'll be like, Dr. Kolby, I'm coming to you. Well, why do I need an hour? It should be 15 to 30 minutes. And you're like, no, it's not going to be. So there's a reprogramming, a retraining, a re-understanding of what this model is going to be like. So that's a challenge. It's a challenge for the doctor, but it's also a challenge for the patient, because they don't know what to do. I think we lost you a little. Oh, there, you're back. You're back. So it's a challenge for both the patient and both the doctor, because it's a new model. The doctor has to teach, and the patient has to be able to adapt. Communication is a big thing. What did you learn in clinic? Some of the challenges with communication?
Yeah, I think that communication is a big part of it. It makes it really, really difficult, right? Because you want to give the client or the patient every resource they need to be successful. But then in that same point, if you were to give each and every person infinite amount of time, infinite amount of availability, then you would not have any time for anybody else. So I think that you have to be very effective and concise with your communications.
Very efficient.
Very, because you can't answer, if you have, we'll just use basic numbers. You have 10 patients, right? Or 10 clients, and they're all functional medicine patients, and each one of them emails you 2 questions a day. If you tried to answer 20 questions every single day, you wouldn't have any time for anything else. So when you do communicate with them, I found that it's best to do it in person, because there's less lost in translation, because emails can be confusing. Phone calls, no matter how good our receptionists or our office managers are, they aren't going to maybe take messages the same way that you or I would. So I always find that in-person communication is the best. But when you're doing it, you want to make sure that any questions they have are like answered in a manner that, or answered completely or to the best of your ability, so that they don't leave with more questions than they come in with. So communication is really key.
That's so true. When I started in practice and I started to get into this functional medicine piece, and it's kind of been my whole career, I never in a million years would have realized that psychology and communication were, and emotional intelligence were going to be this big. Because we got to think of it, right? If someone's not aware of how this all works, if someone is, a client comes in or a patient comes in, and they're dealing with 30 years of chronic illness, they've been to, I know you've had, Dr. Kolby, you've had people that have had 10, 12, 15 doctors, right? And there's a lot of, maybe some help, but a lot of end of the road. There's no more improvement, or they're in the patient's expectations have been let down, and there's remorse, and there's a chip on their shoulder. They're frustrated. They hate doctors. Like, I would say a good 50% of people walk in my office, they hate doctors. And so I was like, oh, well, I get it, but they're still coming in. So there's still a little bit of hope. I never truly could appreciate the emotional burden someone faces going through all that chronic illness and being let down, or expectations not met. And then they come in with all of this emotional burden. There's a lot of it. And it's from our standpoint, I know, Dr. Kolby, it is exhausting. It is so much tiring. Easier. It would be so much easier to write a prescription in 7 to 8 minutes and say, see you later. Come in next month and we'll refill that prescription. Nothing spoken, nothing talked about, no communication, because it's not necessary in a pharmacology model, and is very relatively efficient in that model, because it's assembly line medicine, and there's a place for it. But with functional medicine, it's too dynamic. And so there's that emotional burden that the provider has to be able to understand and meet the patient where they're at. I've seen such crazy things in my clinic. I've had patients hammer their fists on the desk. Not that they're mad at me. They're mad at what I'm going to tell them. Yeah. They're mad at the challenges, or get so scared. They come in and it's like there's a deer in the headlights. Like, oh my goodness, what's this doctor going to tell me now? Well, what's this doctor going to tell me now that I either don't know, or that is just going to set me up for failure again? And they're still coming for help. So it's very hard to enter a relationship with that person. There's not even trust beginning. So I always tell myself, well, they're still coming in, so there must be some hope. I can work with that hope. But, a patient today, I was a client today, came into the office, same thing. There's, I don't know, about 7 or 8 doctors on their list of past doctors. We got 15 years of history of a whole bunch of digestive problems and new neurological conditions. They came in and they're like, a good 30 minutes, 20 to 30 minutes of the whole appointment. This was today. All they were concerned about and really wanted me to know how they went to all these doctors. They couldn't find the outcomes. They felt like they were misinformed or misled or false expectations, and it just ended in failure and financial challenges. I said, I get it. And then, I really had to turn the tables. I said, who wouldn't be frustrated? But I want you to look at the other side of the desk where I was sitting. Imagine you're sitting with me. 50 to 80% of the patients that walk in the door, they are the same way. Recognize where I'm coming from. What can I do? What can I do if you feel this way? And that changed the conversation. It didn't mean that I didn't listen to them and I didn't meet them where they were at, but they had to see what the other side of the coin was. And it helped. But, how did I learn that? Well, maybe with some people, they might get mad and run out of the office, upset with me. But we have to start out neutral. The provider has to be very boldly be as bold as possible if the diagnosis isn't favorable. And
that's where that whole communication part of it comes in, right? If you're not able to communicate, like, yes, I've seen this, I believe I can help this, this is something that's out of my wheelhouse. I believe that this is going to be the appropriate referral. Like, you have to be able to communicate with that with your patient. So
yeah, and the provider has to be emotionally present in all the junk that they have at home. There's no more room for that in the office because you're going to get a lot of garbage coming in and emotional burden. You got to keep your emotional burden in check and have a big smile on your face because you're not only a provider and an educator, but you're going to be a motivator. You're going to be okay. We got this. Let's run this week. Let's see what happens. So that's just kind of some of the emotional challenges associated with relationships and the people coming in. One more thing, and is another thing I notice in practice is communication is fine if someone can understand you. It's not too bad. You're nodding your head, Dr. Kolby. But imagine talking to someone that has so much brain fog that they can only sit for 15 to 20 minutes before they completely forgot what was being discussed.
Yeah, you got to meet people where they're at.
Yeah,
on their level. I think that's something I struggle with. Even like when I use big terms, people are like, "Well, can you dumb it down?" I was like, I don't know how. Sometimes, I really just don't know how, because I don't know how you dumb down the nervous system.
And I think that's one thing I was getting more at when people have severe brain fog and cognitive inabilities. I never knew there was this much of it in this world. I really did not know. So now you're going to talk about technical issues in simplified fashion, so people realize you're not like, Charlie Brown's teacher that doesn't make any sense. But you have to be able to recognize when their brain's shutting off. And I have consults where, an hour and a half, I really kind of shoot myself in the foot, and I start to see they're gone already. Their brains are shutting down because they have so many sick problems that we're like, okay, here's 30 minutes, we're done. I say, well, okay. And they didn't take away. So how do you get them that information? So you're writing things down, you're sending emails. It's very difficult, very, very difficult.
Yeah, for both parties, right?
For both parties, because if they don't know what the heck happened when they got out of the consult, they're just going to be more frustrated and more uncertain, and that's some of the worst things. So there are some challenges. What are some of the other things behind the scenes, Dr. Kolby, that you see that maybe a patient or another doctor looking to go into functional medicine isn't aware of?
Yeah, I think that there's a significant amount of time investment. And when I say that, we're not just talking about visits, but then we're talking about, coordinating supplement orders, or the time that you're going to have to spend outside of practice to read labs or go over images. And though even ordering labs and images takes time. So when you look at all the cumulative time, the time, oh, I got to order this supplement for this person, this supplement for this person. I got to order labs for, Catherine. I got to get an image for Jim. And then I got to read or review the read for, Katie. Like, then all of a sudden you're going, okay, so what is the cumulative time that I'm going to be putting into these behind the scenes? Not at their visit. And it can be substantial. That's something that we've talked about in the past on different podcasts. That's something that I struggle with to this day, because you always want to do the best job that you can. But sometimes, at what point do you have to go, okay, I have some other stuff I have to take care of. It's a very tight rope to balance.
It is. And then you have to figure, okay, what's your patient load? And it all comes down to insurance doesn't cover these things. For me, on average, I looked at this and it scares me. It used to be worse. Then, get more efficient with systems and stuff like that. But right now it's about, for every hour in clinic, I'm spending about 45 minutes behind the scenes on average of every hour I'm in clinic, 45 minutes behind the scenes on paperwork, preparation, lab reading, ordering labs, maybe ordering specific supplementations, checking paperwork. So if you got, like my first appointment, this initial consult, there's 30 pages of paperwork. You can't flip through 30 pages of paperwork and who knows how much lab history while you're sitting in for that hour. You could, but then that hour wouldn't be of any value for the patient. So or for information that you or I would need. So you do that ahead of time. So now you have a 1 hour consult, but you got a minimum of 1 hour on the front end or an hour and a half on the front end of just preparing, reading, researching. And you got to remember, as you and I know, but maybe the listeners don't know, you go in with a case that has 30 years of history, 30 years of medical history, and it's been terrible. Where do you cap how much paperwork you're going to read? And then if you're going to spend 5-6 hours on that case, how do you bill for that when you're only going to see them for 1 hour and they only see the 1 hour you're with them?
Yep.
Right.
Yeah.
It is a balance. It's a balance of, the doctor still has to put food on the table. There's a challenge to it. So time management is crucial for a functional medicine provider, because what the patient sees is just a small fraction of the time going on behind the scenes on their case. But that's where part of the beauty comes from functional medicine. When a patient walks into the office, the doctor should know everything about them. There should be no flipping pages. The doctor should be able to be present, be able to communicate properly, and ask the strategic questions about that are accurate and right. And that's work behind the scenes. So there's challenges with work behind the scenes with all of the stuff that you mentioned. Another challenge is the slow progress. You want to touch on that a little bit?
Yeah, I think that, again, we talked about being framed a certain way, to think a certain way when it comes to our health. And that's, you go in with this symptom, you get this, pharmaceutical. With functional medicine, that's not necessarily the case. It can take a long time. A lot of people are impatient. And that goes for providers too. We obviously want to make it as fast and efficient as we can, but you have to be realistic. If you have this condition that's developed over 30 years, the likelihood that one of us is going to be able to knock this thing out of the park in 2 weeks is not very likely. So you have to be realistic with your time expectations as far as like, okay, how fast do we think this is going to progress? And in all likelihood, it's going to be slow because it didn't come on overnight. So it's not going to go away overnight. Mm-hmm. So just making sure that you acknowledge it's going to take a long time. It's probably going to take reevaluations. It's probably going to take additional laboratory tests to make sure that your management strategy is being effective, but it's doable, but it's just slow.
Mm-hmm. That's very, very, very true. Slow for both parties. I get frustrated as well sometimes. And of course the patients can get frustrated. So the setting the expectations of where it's at and, not over-promising, I think, because that over-promising factor leads to destruction of everybody, mm-hmm. damage to everybody. So there's and we're talking about all these hardships and challenges from a provider standpoint and what's going on behind the scenes and all of the work. But there's no way in a million years that I would do all of that work and have that complicated of a practice and take on those complicated of cases if it wasn't that rewarding,
that fulfilling. Yeah.
I would
I think that once you've done it, And once you see the outcomes, and once you put the effort in, the grind in, and you see the outcomes, you can't go back. You know, it's like I use this analogy with neurology too. Like when I got involved in that, it's like people are like, why don't you just go? I can't do it, because it's like choosing to be ignorant, right? I can't do it.
It's
I can't
true.
do it.
Yeah. It's so true. If you learn a way that works and so much more effective, how do you go back to not?
Yeah, I couldn't do it.
Yeah.
I couldn't do it. And not everyone and you're not going to be able to help every patient, because you're not going to be a good fitter. And there's going to be certain conditions you can't help probably, but for the most part, it is very rewarding. And once you've done it, once you've seen it, and once you've experienced it, you can't go back to not doing it.
That's right. It's the abyss of functional integrative medicine. It's just, it is what it is. And it's exciting. Again, we wouldn't be doing it if it wasn't that rewarding and that rewarding for the clients we're working with, you know, to see that is truly remarkable. And when you can do those things, you will have people flying from out of country. You will have people flying from out of state to come and experience it and be part of it. Like I've talked to you, Dr. Kolby, a few times. We have more and more people flying from out of state. There are other functional medicine providers between me and, I don't know, Texas or Canada. But when they learn enough and they gain enough information, there's that hope component. And because everybody practices this medicine differently, naturally it has to be the right fit for the right person. So
absolutely,
when they find the right fit and the right person, they will pursue that care.
Yeah. And they'll probably get better, right? Because it's a good fit for them. So if you got value out of this week's episode, or you enjoyed it, or you have questions or comments, or you'd like to, you know, have us break down an idea or have a question, you can always reach out to us. We have an email associated with the podcast. It's info@brainstormingwiththedocs.com. You can get a lot of good information off of Dr. Glenn's website. His is drgharrison.com. There's information on my website as well. Mine is www.northlakeschiropractic.com. And if you like this, please share it with your friends and family members. Hit like and subscribe. Turn on notifications, because we're going to continue to roll out new content each and every week. And hopefully we come out with something that's helpful to you.
That's right. Well, that was great, Dr. Kolby. I think we got to shed a little bit of insight on our challenges and our wins in this crazy world called functional medicine.
Yeah, I think so too. And, you know, I love these things, so I can't wait till the next one already.
That's right. Well, it sounds good. I look forward to the next one.
All right, buddy. Talk to you later.
Bye-bye.